In Kolkata, the number of children admitted in hospital is on the rise. There is a palpable scare, but Dr. Arup Halder, a consultant pulmonologist at a renowned city hospital in Kolkata, explains that H3N2 is an influenza variant which has been around for a long time. It is less harmful than the H1N1 variant which causes swine flu.
Swine flu is not the swine flu, it is another variant of the influenza. And this influenza virus actually causes the common cold-like symptoms, but in some patients who are actually are immunocompromised or having some comorbidities in the extremes of age, they become very much susceptible to this kind of flu. And even it has been told, or we have also seen that some form of cardiac ailments often occur after these influenza infections. We get a lot of patients in the winter months who have these flu-like symptoms, and after that they present with some cardiac comorbidities. So they flare up so much, the comorbidities. So that's why influenza vaccine is recommended for all of them.
While the symptoms for influenza and other respiratory illnesses that spike during the seasonal change are similar, influenza is more easily detectable than others, he says.
We have investigations available to isolate the influenza virus, so that is more easily detectable than other viruses, and it is cost effective also, because if we do a total viral profile, it costs a huge, more than 10,000 sometimes. So that's why we have separate influenza panel we can detect the influenza only, because we have treatment for influenza. If you have adeno, we do not have any treatment for adeno, we do not have any antiviral treatment for adeno. But for influenza we have treatment, and if you initiate the treatment very early in the course of the disease, then the prognosis becomes much more greater, or much more favorable in those cases.
Dr. Halder says that influenza is easily treatable with paracetamol and having lots of fluids. Antibiotics have no role to play, he says. Since most viral infections are seasonal, with the onset of summer, respiratory illnesses will decline, he assures.